Next, it is my great pleasure to welcome our next speaker, Hugo Soares, who is Science Manager at Portugal's Agency for Clinical Research and Biomedical Innovation, and he's also coordinator of the ECHOS project. And his presentation is titled, Building National Cancer Mission Hubs, a New Model for Impact. Hugo, the stage is yours.
Thank you, Sarah. Thank you, Deborah. Amazing words. It's honestly a deep honor to be here, being the first speaker at this session, with a room full of patients and friends of this fight against lung cancer. Being in the front, we don't have the notion of how this is. We were one of the first to come. This was empty, and now it's this big, huge motivational support that we feel here. I hope this energy, as you say, continues after the session today. So I was asked to tell you what is going on in Europe in terms of building national cancer mission hubs. National cancer mission hubs, for most of you, would be the first time that you are hearing about it. So I will go one step back and explain what this is, how this was created, this concept, what is in the origin of such a new structure, and especially then focus on how this can be a new model for impact, a new model for collaborative work that will lead for some concrete results and not just another structure of people having conversations and then nothing happening. So I don't think I need to really convince you that cancer is a major societal challenge and the impact that cancer has in Europe. But surprisingly, this was something that took our politicians to figure out, a long time. But luckily, they eventually did reach to this conclusion, and they, in 2020, 2021, came up with two very important strategic documents that led to different actions. One being the Europe's Beating Cancer Plan, and the other the European Mission on Cancer. Europe's Beating Cancer Plan being more of a strategic document. It does not have a financial envelope attached, but it emerges from the high level, the presidency, and should guide activities and decisions in other programs, even those that are funding activities. Europe's Beating Cancer Plan emerged from the research program. It is a dedicated financial envelope, actually the one that supports most of the activities of EBCP, and it aims to make research more actionable. So here we are linking what is research from academia with implementation in the health sector. For the first time, or at least one of the first times, we see that DG RTD and DG Santé, which are kind of the ministries from the European Commission, are talking with each other and having a common goal to move on. So they connecting what is the research with the implementation. I will not go into detail in the 10 flagships that Europe's Beating Cancer Plan has put forward, but you have listed them here and you will have access to the slides if you want later on to check. Some of these are, or as you can see it in the screen, most of these are linked with care rather than research. But for most of these to happen, you need innovation rather than what we are doing now. And so you will find bridges between what Europe's Beating Cancer Plan and Mission on Cancer are doing. You will find some similarities. You have here, for instance, the UnCan platform that is common to both plans. You have the network of CCCs. In one plan, you have a network for CCIs, which is a kind of a second level for the same basic structure. So you have not just widespread the implementation of comprehensive cancer centers, which are advanced cancer centers, but you are already working in the next level of comprehensive cancer centers, which are the infrastructures that go beyond what is the cancer to build a network around the cancer. So we can talk on details about this. Now, the European Commission was also aware that these are two very important documents. They are setting the scene. They have very important recommendations, but nothing happens if the documents stay on someone's drawer, right? So for this to happen and for change to happen, it doesn't happen in the Brussels office. For change to happen, it needs to happen in country level, at regional level, local level, in the communities, at our home, at our hospitals. And for that, they have created this structure of governance where national cancer mission hubs, which was a concept that was coined with the cancer mission, should be created so that there is an implementation arm going from Brussels, from the European Commission, to the communities in Europe, so to guarantee that something would be happening there as well. And this is where national cancer mission hubs came from. Now, coining such a concept is very easy. Building these networks, building these structures, and actually implementing it is the next challenge. And of course, this was something that the European Commission said, so now, who wants to do the job? They said it, they launched, let's say, the challenge for the implementation. They defined the goal. The goal was to have national structures implementing cancer mission, and someone, which is a large group of 61 organizations from 30 different member states, so I'm talking here on behalf of a large group of people, decided to embrace this. And embracing this was setting also the definition and the limits on where a National Cancer Mission Hub is. National Cancer Mission Hubs are not hospitals, are not research institutes, are not patient organizations, are not regulators. They complement all this. They do not compete with any of these. They do not replace any of this that already existed in most of the countries, but they bring a complement to it. They bring what sometimes we miss, which is the time to talk with each other, the time to connect what we are doing in our patient organization with what is happening in the hospitals or in the research labs and so on, bringing them together. So the basics of a National Cancer Mission Hub is the core of collaboration. National Cancer Mission Hubs should be the facilitator, the one that knows the map and how to navigate it. I don't need to be a physician. Physicians are needed in hospitals to treat patients. I don't need to be a researcher, but I need to know who the physicians are, who the researchers are, what each one of them are doing, the regulators, the policymakers, and then bring them together in common actions, being the facilitator rather than the doer. Here is the definition of what the National Cancer Mission Hub. We work in the pentahelix, so we are agnostics. We have nothing against any of the sectors that are the pillars of our society. We work transversally with everyone, and we want to build a network that is based on value, trust, knowledge, diversity, leadership, also respectful, motivation, and so on. At the moment, we have already recognized 11 structures in different member states that are doing exactly this. The way National Cancer Mission Hubs are being created differ from country to country. As you know, you come from different countries, probably you have talked about how is the patient journey around your country, and you know that is completely different. The society is different, so we cannot impose any structure. We adapt. What we demand for our partners is that you have to deliver the best, and you have to deliver what we want, which is not another heavy structure, but something that facilitates and delivers. We are also in the process of creating new ones, so until July you will see not 11 but 18 in this list, and others that are not represented here. We are working on them to create this network. Now, the other thing that is good to explain also because of the new model for innovation is I cannot go into detail in these 15 minutes on how these new models for innovation are actually implemented. So I welcome you to address me during coffee break to know a little bit more on details. But we are developing tools. We are managing and organizing meetings. We are advocating for cancer mission, EBCP, and in the countries where national cancer plans exist, also linking EBCP and EU mission with the national strategies so that we are all aligned and we make the best out of it. We are not competing with anyone. We are not competing with the national cancer strategies. We are here for all because we all have the same goal, which is to beat this humongous thing that is cancer and the burden that it brings to our life. We have tools, we have and resources. We have different ways of operating. One thing that I would like to focus and alluding to what Deborah said is to build better policies, because sometimes this is the art part. We have physicians that goes to ESMO, they know exactly the new drug, but then in the country the regulatory landscape or something is blocking it from delivering it. We have researchers that create new drugs, we have the physicians, we have the patients that know exactly what needs to be done, but then there is legal constraints so I will focus in that part. In that part, we are collaborating with the European Observatory on Health Systems and Policies. This is a partnership hosted by WHO, is a neutral organization to the ground, and is helping us to go to the different countries, talk about and discussing topics that are relevant for the countries. 2 of these countries have chosen lung cancer as a priority to move forward, lung cancer screening to be more exact, to use what ECHOS was bringing to move forward with their policies. We are working in other directions. We are also, for instance, in Ireland, is about the access to cancer treatment to people with severe mental disabilities. This is transversal, could be lung cancer, but often people with severe mental disabilities are overlooked because it's a symptom, they cannot express what they are feeling. So there are different points of view, all of them converging to better treatments. So in 2 of these countries, namely Greece, and later on I will talk about Portugal, the National Cancer Mission Hub has looked into ECHOS and the creation of the hub as an opportunity to move forward with a national screening program for lung cancer. And it started by looking at their own landscape, saying we already have all we need. We have the physicians, we have the patients, we have this, but we are missing an alignment. This is common to both countries. So what we organized was a meeting with all the stakeholders that you have seen, the industry, the policymakers, researchers, academia, patients. We bring up to the room international organizations like WHO, IARC, international experts that were flying from the UK. And we had an alignment meeting saying, this is what we have, this is what we need, how can we go there? Open discussion, closed doors, so nothing leaves the room, so we can actually be honest with each other. There was discussion saying, yes, we need this, but we cannot deliver because of X, Y, and Z. And with that, there was a report and a strategy, that is the Airwise strategy that was developed to inform the community and to inform policymakers. So the same strategy, the same campaign targeting different publics on how to move forward and to engage and to mobilize people to this. I just learned, this was in July last year. In February this year, the Secretary General for Public Health announced the pilot lung cancer screening program to start still this year. And I just learned before the start of this session that new developments are on the way. So we can also talk about that in the break. And Deborah, you are involved in this pilot with the Thermo Fisher, which is something that so it's not just one action, there are multiple actions that emerge from something like this. Something happened in Portugal, so our first meeting was in November 2024. We drafted a report that then we share with the national authorities. And this was last days of November 2024. In February, we created officially a working group. In July, there were published the norms to start the lung cancer screening. With the norms, a hospital that was already had the capacity started the screening in October the same year, so less than 1 year afterwards. A screening program started in one specific hospital that is in the north, but it's a regional hospital, so it's quite large in the region that people attend there. And in April this year, so just beginning of this month, the 2 formal pilots with funding from the ministry were appointed, and they will be starting soon also their activities. So this, and we can see already that at least 7 new cases were diagnosed, so 7 lives potentially saved with this. I focus on this, but I said there are many more things happening with the National Cancer Hubs: HPV vaccination, literacy, personalized prevention. So National Cancer Mission Hubs are agnostic in terms of what we are doing. It's not specific for lung cancer, but we should all work in collaborative and learning from each other. So Greece and Portugal are advancing with lung cancer screening in this setup. This will be, let's say, faster if Italy, Spain, or something wants to learn and adapt from what we are doing. This is the collaborative part of ECHOS. And we are now starting a second phase where we will have this demonstration and implementation wheel, where what was in phase 1 was defining what a National Cancer Mission Hub and having some experience, some testings. Now we are going out of the testing phase towards implementation. And these are the final take-home message. I want to focus on this. National Cancer Mission Hubs are being created in individual member states. So I know that we have several countries represented here. If you don't know what is happening in your country, please let me know. I can inform you and indicate you and guide you to the right people, so you can knock on their doors and say, I want this to happen, because that's the aim of the National Cancer Mission Hubs. Answer the needs of the community. Thank you very much.